Hello, I'm Don Burke, Professor of International Health at the Johns Hopkins Bloomberg School of Public Health. It's our pleasure and honor today to have with us Dr. David Heymann. David Heymann is the representative of the Director General for Polio Eradication of the World Health Organization, and he's been leading the global fight against polio. Tell us a bit about the current status of the global polio eradication. How close are we to eradication?
Polio eradication began in 1988 when there were 1,000 children being paralyzed each day from polio in 125 countries. By 2003, the number of children paralyzed each year was less than 1,000. So there was great progress made, and there were 6 countries that remained endemic for polio: India, Pakistan, Afghanistan, Niger, Nigeria, and Egypt. But in 2003, in the north of Nigeria, there were rumors that the vaccine was not safe, that it was causing sterility in young girls who were vaccinated, and as a result, Nigeria stopped vaccinating for over 13 months. And during that period, polio spread to 18 countries that were polio-free, but that hadn't kept up their vaccination coverage. So we had a major setback in polio eradication, but at the same time, we've been able to recoup and recover from the exportations and to, in addition, decrease the number of countries endemic by some new vaccine development.
Has the government of Nigeria been cooperative in the effort more lately?
The government of Nigeria was cooperative from the start with this activity because it was a few rebel governors in the north who dictated the policy. The government tried to rectify the situation, but as the Minister of Health often told us, we're a democracy and we must build a consensus before we will be able to begin vaccinating again. So WHO and the polio partners, who are UNICEF, Rotary International, and CDC in Atlanta, worked behind the scenes with the Islamic community, with the Islamic Conference, which passed some resolutions on polio eradication, and with clerics, religious leaders, and academics who pronounced fatwas in favor of vaccination. And when all this was in place, then the government was able to neutralize the situation and again begin vaccinating. But it took 13 months.
As we approach polio endgame, how will it come to an end? Will we just stop? Will there be continued immunization? What's the right strategy to make sure that polio is gone for good?
Once wild polio virus transmission has been interrupted, there will be a risk of continued polio, and that will come from vaccine-derived polio viruses and also from VAP, vaccine-associated paralytic poliomyelitis, which occurs for each 2.5 million doses given to a newborn. One of those children will be paralyzed by the vaccine itself. So the risk of paralysis from vaccine will be greater than the risk of paralysis in nature, and the vaccines will have to be stopped. But it will be a very difficult endgame because the vaccine, the oral polio vaccine, must be stopped in every country at the same time in order that one country doesn't harbor vaccine-derived polio viruses. We believe from modeling exercises that the greatest risk for VDPV, or vaccine-derived viruses, will be in the first year after cessation of oral polio vaccine. So at some point in the future, possibly the 31st of December in some year, 3 or 4 years hence, the world will have to stop oral polio vaccine in a synchronized and simultaneous manner, withdrawing all unused oral polio vaccine, destroying that vaccine, and stopping vaccinating. At that time, countries must have in place a national policy whether or not they will continue to vaccinate against polio, and if they do, they'll have to use inactivated polio vaccine. At the same time, there will need to be a global stockpile of monovalent vaccines available should there be a polio outbreak, and a system to detect that outbreak should it occur. And finally, there will need to be a locking up of all specimens in laboratories, either of polio viruses, of specimens of stool which could contain polio viruses, both wild and Sabin, and also of industries that are using the wild virus to produce an inactivated vaccine. So the end game for polio is a very complicated and very costly end game.
How do you answer the critics that say this kind of very vertical, single disease-oriented program drains resources from other important health care efforts in developing countries?
Certainly the $4 billion US that have been invested in polio eradication to date could have been placed elsewhere. They could have been placed in health systems, they could have been placed in many different areas. But the fact remains that once polio is gone, there's no more cost to society from this disease, which is a terrible disease. The benefits of the polio eradication will be numerous. They'll be, for example, in a network of laboratories around the world that's been set up. Over 150 laboratories have been set up that are able to isolate and many times characterize polio viruses from stool specimens. These laboratories are already being expanded to deal with yellow fever. They were very active during the SARS outbreak, and they're very active in other outbreaks. We're beginning to think about linking them with the global influenza network as well. So these laboratories are one benefit of polio eradication that will continue, good quality controlled laboratories. Another infrastructure strengthening that's occurred with polio eradication has been the cold chain to preserve vaccines. Each country has renewed and rejuvenated its cold chain to participate in polio eradication through UNICEF, and that will continue to be a vital resource to the country. But the most important infrastructure strengthening has been in human resources. There are now people in all countries who can do micro-planning, determining how to get services from a peripheral health center out into the community. There are community social mobilizers who are mobilizing populations to accept vaccines. And there's a whole series of epidemiologists and program managers in all countries who are working with polio who will take those skills to other activities. So the answer to the question is a targeted intervention, if it's done properly, can leave behind a whole series of infrastructure strengthening which will benefit other public health programs.
The original date for eradication of polio was set at 2000, but that date has now been shifted back. Is it wise to set another date, and if so, when will that date be?
In 1988, when the World Health Assembly of the World Health Organization passed a resolution to eradicate polio, the target was 2000. That target was missed, and after that, a target of 2005 was established. This was a target behind which WHO and the partners were able to mobilize all heads of state that still had polio. And they've stuck to that target. Each year we've met with ministers of health who have said, yes, we will do the job by 2005. They're very close, most countries now, and at our most recent technical advisory meeting 3 weeks ago, there was a conclusion by that committee that all countries could interrupt transmission of polio within the next 6 months because of the new monovalent vaccines except Nigeria. And Nigeria would probably take an additional 6 months. So we're hoping that by the end of next year, polio will be gone from the world. We will not set a new target. We're so close that that target of 2005 will remain.
Well, David, thank you very much. This is you're a fount of information on this, and it's a real honor to have you come join us here at the School of Public Health.
Thanks, Don. It's been a great pleasure to be here today.